This is a quick little educational video on how to administer your daily injection of Lovenox. All of our patients are prescribed Lovenox after bariatric surgery to help prevent blood clots in your lungs and in your legs. These injections are administered on a daily basis. You're going to take one a day for 28 days after surgery. You will be given these injections in the hospital as well. The first day after surgery, we call post-op day 1. We want you to actually watch the nurse give this injection to you. Post-op day 2, or the second day after surgery, we want you to go ahead and give yourself the injection with the nurse watching you. That way, if you have any questions, they can hopefully help answer those in real time. It is extremely important that you make sure to follow all of these administration instructions. Step-by-step instructions on how to administer your Lovenox injections are as followed. You want to make sure that you're identifying your site and preparing the skin for your injection. So you want to wash your hands and dry them very well to make sure you have a clean starting point. You want to lie in a comfortable position, lie either on a bed propped up on pillows so you can see your abdomen, or you can lie back in a recliner, whatever is most comfortable for you. You want to identify the area that you want to use to give your injection. You may use either side of your abdomen, avoiding any incision sites. You may also use your thighs if your abdomen has a lot of bruising or it's more comfortable or easier to see on your thighs. Either one is okay. Make sure you're alternating injection sites daily, going in a diagonal pattern, left to right, working your way up, down, and then once you've reached the bottom of your abdomen, you'll start back over at the top again with those alternating sites. Bruising is very normal for these injections. It can be very prominent. You'll just want to avoid those areas of bruising for the remainder of the time that it's present. Make sure that you're giving your injections at the same time every day. I would recommend setting up a reminder on your timer on your phone, or use the Baritastic app that we have and that you should have downloaded as a reminder. And you can actually set the reminder as Lovenox injection medication. That way you're giving it at least in the same time frame during the day. And remember, you're only giving it to yourself once a day. Do not inject into the muscle at all. This medication is meant to be injected into the fat of our body. So making sure that you're doing it actually in the abdomen or in the fat of your thigh. Avoid injecting the medication into any bruised or scarred tissue area, as well as the incision site, as I mentioned before. At this point, you're going to clean the injection site with either an alcohol swab that you can get from any pharmacy, or rubbing alcohol with a cotton ball swab. Either one is fine for this. You just want to make sure you let your area that you've cleansed dry really well before giving your injection so it doesn't sting. So getting to know your Lovenox syringe. The Lovenox injections come in single dose syringes. So they come in a little packet of several. You just tear off one, and then this is really ready to go. There's no need to drop any medications for these. The syringe is really ready for you to use. You're going to go ahead and open the package, pull out your syringe. It may look a little bit different than this. Every manufacturer is a little bit different. So this is ready for you to take the cap off. You're going to pull straight off, don't twist it. You're going to pull straight off, and it's ready for you to use. You're going to hold it like you're holding a pencil. There is an air bubble at the top of the syringe, which is a little bit difficult to see from your standpoint, but I want you to try to hold it up, look at it, and you should see this little open area at the top of the syringe. So when I say top, this plunger, this yellow plunger, is the top of the syringe. The needle is the bottom. You should see the air bubble at the top. If you don't see that, you're going to want to try to either flick it so the air bubble comes to the top, or you can do this kind of reverse softball throw, and that will automatically bring that air bubble to the top. You will not want to expel the air bubble on this. This is meant to be there. It is meant to help hold that medication under the skin after the injection. So using your writing hand, hold your syringe like you're holding a pencil. And then using your opposite hand, you're going to pinch your cleansed skin where you've already cleansed with your alcohol wipe, And then you're going to hold it with your thumb and your forefingers. Insert the whole length of the needle into the skin fold and make sure you're pinching the skin fold throughout the entire injection as well. You're going to go ahead and press the plunger of the syringe until the contents of the entire syringe are injected under the skin. You're going to wait 3 seconds, 1, 2, 3, and then pull it straight out. So I want you to lie into a comfortable position. Lie on a bed, propped up on pillows, or lie back in a recliner. You want to identify the area that you want to use to give your injection. You may use either side of your abdomen, avoiding incision sites. You may also want to use your thighs if your abdomen is tender. Make sure to alternate injection sites each day to avoid giving injections in the same area, and bruising is very normal with these injections. So after you've cleaned off the injection site with either an alcohol swab or cotton ball with alcohol in it, make sure to let it dry completely. The Lovenox injections come in single dose syringes. There is no need to draw up any medication. The syringe is ready for you to use. So you remove the cap of the needle, pull it straight off, don't twist it as it can damage the needle. Pinch the clean injection site with your thumb and forefinger. With your other hand, insert the whole length of the needle into the skin fold and make sure that you're pinching the skin fold throughout the entire injection. Press the plunger of the syringe until the contents of the entire syringe are injected and empty. While holding the plunger, count 3 seconds. Then remove the syringe from the injection site. With the needle pointing away from yourself and others, you're going to firmly push on this plunger end, and you're going to hear a click. The protective sheath will automatically come over that needle to help prevent sticking and injury of yourself and others with disposal of the needles. Dispose the empty syringe in a heavy plastic type container, such as an empty milk jug or an empty laundry detergent container, and then hold on to those until you're finished with your series of injections, and then go ahead and take those to your local landfill, and then they will instruct you on how to dispose of that container. We do not accept empty syringes here within the hospital anymore as they used to. If you have any further questions regarding your Lovenox injections, don't hesitate to MyChart message the bariatric surgery team or call the clinic at 319-398-6747. Thank you.